Hello, Gerd. What is it and how to fix it, especially as a woman over 50 when we want to age gracefully, turn off the pain in our body, and lose the weight? But you've got Gerd. What are you going to do? So, this is what we're going to talk about. I'm going to talk about what's the happening, why it's, you might have belching, you might have burping. You could have so many symptoms in your body. Did you know you could even have dry skin and hair loss because you'll have GERD? So GERD is a process of, or a disease of low stomach acid is stating, but this is a lifestyle disease. So it's not something you actually have to keep or to put up with. And so you want to kind of have that mindset going into your 50s is what can you change? What can you correct? What can you do to support your body, choose health, and to turn off the disease causing process in your body? Because it's lifestyle management that you want to look at. You want to not have the diseases of lifestyle. And so GERD is one of those. It is not something you have to have, and it is not something that's inevitable, but you might have it. And so what are you going to do? So basically you want to realize that GERD is called acid reflux. It could be called heartburn. You can have symptoms of bloating and gas and belching and not feeling comfortable in your body. I've had a client that had to lay down after eating because the food that you're eating can cause this problem. And so when you actually stop eating that food and pull in, this is what you want to do, pull in an anti-inflammatory diet and lifestyle like my holistic low carb method will actually support this and turn this around so you don't have to suffer with it. So that's one of them. And then the other thing would be like apple cider vinegar and lemon and ginger. Bring in some fermented foods so you can actually activate your stomach so it's functioning. Part of the problem is people are not eating enough protein and fat. When you stop using your body the way it's designed and you're not eating an ancestral protein-based diet, what is happening is that your digestion gets sluggish, your acid levels get lower, because GERD is actually, science has shown that it is actually not enough stomach acid in your body, not too much. The problem is that when you're not having the right amount of stomach acid, then the lower esophageal sphincter in above your stomach doesn't open or close correctly. And so when your food is not digesting because your stomach is too low, your food is going to stay there and stall out and kind of cause problems because your body can't digest it because you don't have enough stomach acid. And so that muscle gets loose and your food, the acid backs up into your esophageal, and that's where you feel part of that burning, and you think you have heartburn or you have heartburn, and that's going to cause problems long term with esophageal cancer and all these other things long term. You don't want that long term. You don't want to build up damage. So you want to take control of it now. And so what the doctors are doing is treating your symptom of low stomach acid. And so GERD is a symptom, is a process, or is acid reflux, but it is a symptom of low stomach acid. And so with the functional nutrition, the way that we solve this is to give you some apple cider vinegar, lemon juice, download my belly fat hacks workbook. And I also have the belly fat buster mini course that has the workbook. And so that's going to help you kind of get started with digestion, because this is a digestive issue. And with digestion, there you go, you have that hair loss, you have the dry skin, you're not digesting your food, your stomach acid's too low. When your stomach acid gets too low, the intrinsic factor in that lower area of the between the stomach and your esophagus, your intrinsic factor, you can't create your B12. Your stomach acid is too low. You're not creating glutathione, so you're not getting detoxification. You're not breaking down your food. And so this is a part of digestion. And this is something I work on with all of my clients because we need to address low stomach acid and bring in digestive enzymes. So one of the things you could do is start with an ancestral low carb method diet plan or lifestyle. Bring in apple cider vinegar, lemon juice, ginger, get your stomach working, bring in more protein. Contrary to what the medical system is saying, you do need more protein. And you want 30 grams of protein per meal, but you need to break it down. So you want to build up. If you're not used to eating more protein, then you want to build up and get more, because you also want to have muscle growth. And so there's this a whole lifestyle factor. And so even as I'm getting into this on GERD is you do want to bring in some apple cider vinegar. You do want to have an anti-inflammatory diet. You want to bring in digestive enzymes and maybe some hydrochloric acid. And, even more salt is needed to help you create more stomach acid. So bringing in those fermented foods, bringing in that salt, those are the things that we need to do to actually turn your digestion back on so that you could actually digest your food, because you are what you absorb. So if you want better health, you want less disease and pain in your body, you want to be active, you've got to get your stomach working. And you want to make sure that you're getting the right amount of fat so that your bile is functioning, so your gallbladder doesn't get stagnant and have cholestasis. You want everything functioning. So if you stop eating the food that our body was designed to eat and focusing too much on carbohydrates, then you're going to have that breakdown of the digestive system. And GERD is one of those symptoms. So it is being called like acid reflux disease, but I mean, the medical system likes to call everything a disease so they could give you pills. And so if you don't want to have pills, we still do pills in a way, but targeted supplementation to support you. And then the other side of this is to actually look at what's going on in your body overall. So running a GI map gut test, which is a stool test you can do in your home, what this is going to do is show you what your digestion is doing. It's going to show you your bacteria. Do you have the streptococcus, which is your bacteria that's usually in your mouth? You'll be swallowing this. If you have too much of it, it's because your stomach isn't killing it off, and it's usually a symptom or shows too much stomach acid in your body. So you'll have that elevated. And a lot of the other things that are going to be elevated could be your fat digestion could be showing distress. Your pancreas could be showing distress, because I was just reading that if you're not breaking down your food and too much large particles of food go into your small intestines, you end up with SIBO, which is small intestinal bacterial overgrowth. And all of this downstream can cause autoimmune problems, dysbiosis, and bacterial overgrowth, and candida, because your stomach, one of the things it's not doing is killing off the bacteria. That's coming into your body. It's not killing off the pathogens. So bacteria is moving in, pathogens are moving in, and you've got a breach in your immune system. And so you want to look at this. I always look at this as a whole body factor, whole body support for you. So you have a symptom of GERD, but that's just a symptom. What's going down in your body, and what can you do holistically and as a lifestyle to support this? So not many people are going to specifically tell you that this is a whole body lifestyle process, because maybe it's overwhelming for you to think that you need to do all of this, but you don't need to do all of it at once. So downloading my Belly Fat Buster mini course with the workbook is going to kind of give you some ideas of what you can do to help your digestion, and to watch the workshop that I had on my Belly Fat Buster, because what that's going to do is help you get started with the right amount of, with lemon juice and apple cider vinegar, and kind of give you some guidelines and bringing in and supporting your digestion, and really looking at the beginning stages of what you need to do to turn your body back on so it can work for you. Because, if your pancreas is suffering because your digestion's not working, then you're losing your immune system, and you're going to have more elevated insulin levels, and you're not going to be in the best shape that you can be. So you want your pancreas to be functioning. You don't want it to get worse. And you want to make sure, too, with an anti-inflammatory diet, that you're actually keeping your insulin levels low. So the gut test is a really good one to really show us what your fat digestion's doing, what your regular digestion's doing, how you're reacting to the wheat in the diet, and also how you are, what bacteria is showing, whether it's showing you've got SIBO. There's some bacteria that are specifically more methane producers who are going to show you that you have that, and you might even be showing that you've got candida. And so these are the downstream problems that are happening when your stomach isn't working, when your digestion is off, and you're having problems with all of that. Those are the things that you want to focus on, because that's the start. That's what the number one thing that most functional nutritionists and practitioners are going to focus on for you is do you have digestion? Are you breaking down your food? Because you are what you absorb. And are you having constipation, which is a symptom of SIBO and a problem with your digestion? And so all of that needs to be corrected so you can detoxify your body, and so that you can actually absorb your nutrients. And so if you've got GERD and you need to fix it, and you want to know the steps to do it, and you're over 50 as a woman, and you really want to get your health back on track, these are all things that you can focus on. And if you need help with implementation, I am always here. That's my job. I run 6 diagnostic labs, so you find all your hidden healing opportunities and those weight loss blocks, so we can put you back together like Humpty Dumpty and fill in the cracks and get you working again. And so it starts with digestion. And so let's go back over the steps of what's happening in the body. GERD is basically a symptom of low stomach acid. Doctors treat the symptom, but science is showing that this is a symptom of too little stomach acid. When you stop eating your protein and your fat, your gallbladder will stall out and your stomach acid gets lower. And so part of what can happen, and 50% of the population ends up having more problems, you're getting more viruses, you're getting more bacteria in your body, you're getting more parasites. And so this is the problem. A lot of people get H. pylori. H. pylori is a stomach bacteria that will move in and continue to lower your stomach acid and make itself very comfortable. It's a gram-negative bacteria that ends up in your stomach, causing problems, and that's one of the things that causes ulcers in your body. And so that's what you want to really be aware of. Anytime we find that on your GI map, we want to kill it. We want to kill it because it's causing digestive dysfunction, it's causing you not to be able to absorb your B12 or your glutathione, and it's also causing the downstream problems with constipation, SIBO, and dysbiosis, contributing to leaky gut and food sensitivities, and your immune system being lower. And so that's why we have to focus on reducing the GERD. So if you've got GERD, it's not just GERD. This is not, I've got low stomach, I've too much stomach acid. You don't have enough stomach acid. And so you want to bring in the apple cider vinegar and lemon juice on a regular basis. I had a whole lemon yesterday, and I actually peeled off the pith or the lemon part of the peel, and I ate that, and I put it into my salmon and egg pancakes that I fix. So that was really good. And then anytime you can get extra ginger in your diet, that's going to be a really good anti-inflammatory herb. And then fermented foods. I picked up some kimchi yesterday. Kimchi, I want to eat more kimchi when I have my food. That's my biggest vegetable that I'm focused on. And I picked up some celery because I like celery. So that's the fiber that I like to have. And, you want to drink water away from your meals, not at your meals. So if you're drinking any carbonated beverage or any beverage with your meals and you'll have symptoms of low stomach acid, you need to stop that. Drink your water before your meals. If you're drinking carbonated beverages, don't drink them while you're eating. Make sure your carbonated beverage doesn't have any added sugar, because you need to have an anti-inflammatory low carb diet and lifestyle dialed in so that you can get the benefits of that, so you can put your body and your digestion back together so it can function. And then digestive enzymes. You can experiment with hydrochloric acid. You don't know if you have stomach H. pylori until you test with a gut test or an H. pylori test. So you need to get that test. And if your doctor doesn't do it, that's something that I do with all of my clients. And that is something I also retest for, because we need to know it's gone. And then you have to heal and seal the gut, and you have to actually correct your stomach because it has inflammation now, and we want to correct that inflammation. So there's a few steps that can go into correcting this, but you do want to correct it because you don't want to just assume you've got GERD, you're going to take the pills that the doctor gives you to treat high stomach levels of acid that you're getting a symptom of, and then be there for 20 years. Because now you don't have B12, now you don't have glutathione, now you're not detoxifying your body. You've got those downstream problems and your body's breaking down. So a lot of the times what people will say at 50, my body's just breaking down. What's going on? Well, it's the accumulation of metabolic dysfunction that's causing this breakdown, and this low stomach acid that contributes to all of that people just aren't aware of. And then your pancreas is suffering. Your pancreas is breaking down. Your immune system starts to break down. And so by the time we get to 50, that's just a big burden on the body. And we want to stop the toxic burden in our body. We want to correct it. And so that's my job as a practitioner for functional diagnostic nutrition. That is what I do. That is my specialty. But I also marry this with looking for your weight loss blocks and tuning into where you are in your body and putting you in a low carb method, my low carb method, so that I could get you to lose the weight too. So you got to find the underlying hidden healing opportunities And we need to correct that so we could get your body to lose weight naturally. And that's why my body is getting back down into 129, 128 again, because I was hanging out at 130, 131. I just kind of balancing out and back down again, building more muscle, staying strong, eating my protein, keeping my carbs down, getting outside and activating my fat loss as best I can. These are the lifestyle factors that you want to do, but you want to bring in that lemon juice, bring in the apple cider vinegar if you need to. It's going to feed and nourish your gut microbiome as well, because that's where you're going to get the alkalinity into your gut. When you get the short chain fatty acids created in your gut with the good fats and the good fibers, fermentable fibers, that's what's going to bring the health back to your body. So you want to look at stomach digestion, small intestine health, colon health, the overall process of what's going on there with your digestion and your gallbladder. And if you don't have a gallbladder, it's okay. We can still fix that. We can still fix GERD, because you want to focus on stomach acid and have more hydrochloric acid created, whether with the salt, the apple cider vinegar, bringing in the digestive enzymes, bringing in HCl, hydrochloric acid, if you need it. Now, but the problem is, if you have H. pylori, it's contraindicated to have the HCl, so I don't recommend starting there. I would recommend starting with the apple cider vinegar. So download my Belly Fat Hacks workbook, DM me and ask for a copy, and I'll send you the link. And I might put it into my stories after I download this. But just to know that you don't want to have low stomach acid. Don't assume it's normal that you have to put up with it and you're going to take the pills from the doctor. They do not treat GERD correctly. They're not treating acid reflux correctly. They are treating the symptom. If you want to correct the root cause, that's what I do with my clients. I'll help you correct the root cause all the way down through the colon and all the things that are coming out. You know, you just want to look at it as like an iris. It starts out like a small root, kind of grows and branches off. All the flowers, branch off. And so you want to follow all of those branches and correct them and get your body working, fine tune your engine, because we're going to look under the hood and discover everything that's happening so that we could fix the GERD, so we could turn off the acid burn, so you could stop the belching and the burping. That's what my clients do. You do not have to lay down after eating from all of the pain and dysfunction of a diet that isn't working for your body, that's causing the higher stomach acid to just burp up. And we want to fix those things, get your stomach to be able to have the right acidity so that you could drop your food into the small intestine already digested and working for you, so that you don't have to have small intestinal bacterial overgrowth. Rosacea is a symptom of that, and constipation is as well. So there's so many supplementations that we could do to support this, but I need to know exactly where you are, and that's why I run a metabolic analysis and give my clients a metabolic and adrenal test so that I can actually map out what's going on in your body. Like a client that I worked with yesterday, she had 300 past symptoms, but currently was up to 500 symptoms in the body of severity, because it continues to get worse. Don't let it get worse in your body. Let's correct your digestion. Let's get your stomach acid functioning better. Let's get you into the a low carb method, so that you can actually start eating the diet that's right for your body, because you don't have to put up with this. As a woman over 50, we can be empowered, we can learn, we can figure out what's going on inside our body, and we can fix it. And if you just don't know, that's okay. I didn't know either, and I had to learn. And so that's why you hang out with somebody whose special sauce in my special process is lifestyle management for holistic low carb method. And as a functional diagnostic nutrition practitioner, I marry all of my education together with running the 6 diagnostic labs, all of my lived experience, because I've been 225 pounds and I am 100 pounds of fat loss down and keeping it off and building muscle at 61, so that I can feel amazing and feel gorgeous and feel beautiful and wear the clothes in my closet. I actually had to throw them all out and go shopping, and then my yoga instructor gave me more clothes, so now I have new clothes. And so it's all about making a choice for health. And so this is your health as your wealth, and you can get into a health adventure lifestyle like I do and create that health as your wealth, because you're worth it. Everybody should have the health that they want. You don't have to put up with disease. You don't have to put up with the GERD or digestion that isn't functioning. And if you don't know, that's just, go to my YouTube station. I've got a lot of videos there. I'm going to send this one there as well. And check out the one on digestion. because I did put one out there. No, I put one out there on bloating as well, as the other side of the GERD is all of the symptoms of bloating. So that's in there. And I also have one on allergies. So just stick with me, get educated. If you would like to find out more about how to get started in my holistic low carb method so you could address all of this year in the next 6 to 8 months, fine tune your body, get your beautiful back, feel gorgeous in your body, and be active, that's your right. And as women over 50, we should have fun in life. We should not have to just feel like we're dying, that we are aging, that this was it. This was all there was to life, and we're in midlife, and that's it. We don't have anything else to look forward to. Not true. I'm 61, keeping 100 pounds off, pain-free, be active. I've got a new boyfriend. I feel amazing. Come on, ladies, you can do this too. I'm not special. I just kept looking for my weight loss solution, and I found it. And so now I am on a mission to help empower women to choose health and get healthy to lose the weight naturally using 6 diagnostic labs so that you can get the body back that you want to live with into your 50s and 60s and beyond, into your 90s. You can live healthy, but you'll have to put your body back together again. So that's what I do. And if you're interested in working with me, I've got space for 2 women currently while I work with the 3 that I just brought in. And so just let me know. I'm here for you guys. And if you found this information good, share it with a friend, with a family member, and get yourself accountability with somebody, if not myself, and just keep working towards getting the health that you're looking for so that you can feel amazing in your body. Don't put up with GERD. Don't put up with acid reflux. I don't think it's a disease. They call it disease. It's a lifestyle issue. This is a metabolic dysfunction, ladies. Somebody mentioned yesterday that this is metabolic disease. And if you're overweight and you're having metabolic dysfunction, this is a metabolic disease. So in a way, I guess it is a disease, but that's what they're terming it because it will continue to get worse and create more diseases in your body that you might not be able to stop. And the best thing to do is to prevent it. And so you need to fix GERD to prevent lifestyle diseases so that you can have the best health that you want in your retirement and beyond, to just feel your best. And we can do that. And that's what I'm doing, is helping educate you guys so that you can have the health that you choose. So let me know if you have any questions. Let me know if you have anything else that you want me to bring up in a story or in a live like this that I could answer questions. And if you would like a little health voice audit, just let me know you'd like to ask a question and I can give you a voice answer and we can kind of chat a little bit. So just let me know. I'm here for you guys. I'll talk to you soon. Bye.